on this page, we've chosen to actually put in some personal stories of people with MS, talking about either their experience of working or actually their experience of disclosure. And I think one of the big things I would like to say is that came out of the research that we did to develop the toolkit is that disclosure isn't a one-time only. If someone is quite well looking, they often have to remind people, which is actually a bit soul destroying, particularly if they've got some adjustments that mean they take breaks and people get a bit narked. But also, it can also bring back feelings if they've how they felt at diagnosis, because they have to deal with other people's reactions, which might actually mirror the reaction that they felt when they were told. So actually they've got to feel able to cope with people responding in either a shocked or even distressed manner, which in some ways is inappropriate because it's not their problem, but that can be the way people react. And so that can be quite stressful for someone to manage. And when it happens more than once, it can also be quite draining. But also what I think is important about these stories is they're told just as a telling of a story. They're not filtering. We all have filters on our stories. They're not filtering this story to you, because they may even not tell you it in this way as a healthcare professional, because they'll be thinking, well, you don't really want to know about this. You're here to talk to me about fatigue or my drugs or whatever. So they may not tell you about this, how this made them feel particularly. Equally, when you listen to people's stories, sometimes your mind is also thinking, well, how am I going to help? So you're instantly into helper mode rather than just listen to what they're saying. And just listening to what people say can actually be quite powerful and actually quite useful, and actually help you when you next hear someone talk about disclosure, to help you facilitate them to talk about it, to actually perhaps get it off their chest how upsetting it might have been, and then you can actually help by saying, in future, how could you manage this to make it not be such a difficult situation? It can actually help you give better solutions because you're hearing more of the story.